Sô-Ava, a city in the southeast of Benin, about 30 kilometers from Cotonou, the economic capital. This town of 12,000 inhabitants, divided into 7 districts composed of 69 villages, straddles the Sô and Weme rivers that flow into Lake Nokwe. In this area, which lacks infrastructure and accessible only by canoe, poverty is a daily reality for most families. Among them, that of Juliette, a mother of 30 years old, including 13 years of marriage. Married to a man 5 years his senior, the young lady is a mother in a family of 6 children, the last born on her lap. Under these conditions, it is difficult to properly support the family needs. It is difficult to take care of the children, but it is in God's hands. We have discussed the issue of family planning with my husband, and he's not ready for that. He still thinks that we can have 1 or more children before making the best decision. I'm well informed about the new methods of birth control. I'm aware also of its advantages. In Benin, the average age for marriage is 18.6 years, according to the 2012 Demographic Health Survey. Among married women aged 15 to 49, only 13% use a family planning method. Eugenie is part of that group. The young woman hurries to feed her crying baby. This 18-year-old is a mother of a child of 4 months, 9th grade student. Eugenie was married a little over a year ago to a man very older than her. With the support of her husband, she decided to use contraceptive methods to prevent unwanted pregnancies, to rest and better take care of her baby. When we have started using the family planning, it was beneficial for the whole family. But to be honest, my husband and I would like to have 3 kids. So far, everything is fine because when I first heard about it, I went on a Bark Mobile and get information. And now the message I would like to convey to other families is to use the family planning without hesitation. It could only be a good thing for them because having children here and there is a lot of work and one must take good care of their children. Eugenie was able to count on the services offered aboard this boat of new genre, the mobile clinic boat for family planning. This is an initiative of UNFPA, the United Nations Population Fund, an ongoing initiative since 2015 to improve access to family planning products and services. In our area, we can only move around by small bark. The patient should have necessary means to afford that trip to the centers where services are available. The patient should use the bark. Sometimes it is difficult. They want to, but don't have enough money to take the bark for transportation, and we get stuck. Now that the bark is coming towards us, the family planning bark mobile, which brings us care and family planning services in our room, within the population, we can only applaud for that approach. This can only help us reach out easily the population. UNFPA Benin has indeed made available to the 8 health zones covered by this program a lot of materials and equipment made up of medical supplies, contraceptives, 3 mobile clinics boats worth 18 million CFA francs each, and a mobile family planning clinic. These investments, carried out in collaboration with several public and private partners, help Benin to contain its demographic dynamics, still on the rise, and thus allow the country to fully enjoy the benefits of the demographic dividend.
La planification familiale est une question très importante pour le ministère de la Santé au Bénin.
Family planning is an important issue for the Ministry of Health in Benin. Knowing that with the family planning, we are more than convinced that we resolve many of our problems. especially the maternal mortality, which is very high in Benin, family poverty, and it will help us improve family standards. So our focus is on the family planning. Despite some financial difficulties we're facing, despite the social situation we have in the sub-region, Benin values greatly that issue and grants enough resources to that effect. We sensitize the population. We distribute products such as birth control pills, condoms, and others. And we also organize specific missions inside the country and discuss with the population, raise awareness about the importance of family planning to control birth and reduce major family issues.
De contrôler les naissances pour une meilleure maîtrise des problèmes de la famille.
Le Bénin a des indicateurs en la matière qui ne sont pas très reluisants.
Benin has some monitoring indicators that are not very attractive. I can name a few of them. We are in a country of more than 10 million inhabitants, but the maternal mortality can go from 335 deaths for 100,000 child alive. This is an indicator.
Un deuxième indicateur, la contribution des adolescentes à la fertilité est relativement élevée.
Second indicator is the adolescent contribution on fertility, which is relatively high. That contribution is about 20%. It means that in a country like ours, a young girl aged 18 has been a mother at least one time in 32% of the cases, or has children at that age. And this happens in the rural area. This is not the best indicator, and we can add that in Benin, the birth control prevalence or the modern methods, regardless of the one we wish to use, does not exceed 15%.
Ne vaut pas 15%.
With a total population in 2013 which exceeded the threshold of 10 million inhabitants against 6,700,000 in the previous census in 2002, with the Democratic Republic of Congo and South Sudan, Benin is part of the 3 African countries where the population is growing the fastest, with a growth rate of 3.25% per year. On the ground, several civil society organizations ensure awareness and advocacy campaigns on the benefits of family planning. This is the case of Benin Association for the Promotion of Family Planning, a pioneer in the promotion of family planning and reproductive health in Benin.
It is true that in Benin, the context is marked by a stagnation of the contraceptive prevalence rate in recent years, and we have seen progress from 6 to 7.9% according to the 2011 report. It is true also that Benin has a national action plan budgeted, and we felt that all actors must contribute to the implementation of this plan, and that's what we are doing now. We also know that the youth rate is estimated at 33% of the population, and we know all the problems they encounter, whether in employment, health, safety, or other issues. Therefore, it is important to use the APF as a large pillar to initiate the development of the country, because when the fertility issue is mastered, the growth rate will be balanced, and we can have the demographic dividend. This demographic dividend is a challenge for the stakeholders and for the partners we work with to support the association, in this case, the IPPF, which is our parent body, the United Nations Fund for Population, the UNFPA, the Embassy of the Netherlands, the WAHO, the West African Health Organization, and of course other structures, not to mention the Ministry of Health, which is the supervisory authority which regulates this sector.
The non-availability and limited access to contraceptives are some of the reasons for the low prevalence of contraceptive methods in remote areas of Benin. The CAME, Central Procurement Agency for Essential Medicines, decided to supply all health zones of the country quality equipment and materials and thus meet the demand for contraceptives.
Depuis 2-3 ans, la disponibilité de
For the past 2 or 3 years, the availability of contraceptives has increased in Benin, and if a facility says that it did not receive any, it is out of goodwill, because we have enough stock and we have the chance to be part of the WOW regional program, as we often meet as stakeholders. The mapping of Benin today in terms of availability of contraceptives is better compared to many countries in the sub-region.
Très meilleur par rapport à la situation de beaucoup de pays de la sous-région.
The strong population growth in Benin is a result of a high fertility rate, which is 4.9 children per woman. At this rate, the population will reach 13 million in 2028 and will double under 25 years, with a strong pressure on social demand. Through mobile clinics boards and awareness campaigns, like here in Ganvier, a picturesque town about 20 minutes of Sô-Ava, interest in the new contraceptive methods is rising. However, the stigma attached to the past are still stubborn. The family environment and the local social-cultural context is not always favorable to their adoption.
Il y a certaines populations qui pensent que la pauvreté, c'est une fatalité.
There are some people who think that poverty is inevitable, so they do not make efforts to overcome poverty, because some say, if I have no money, I have to at least have children, as if the children was synonymous with wealth. If a child is not well fed, not well maintained, not well informed, that can't be called wealth. It can even be a problem.
Il peut même être un problème.
The low use of contraceptives by women is the main reason of frequent pregnancies, the high number of abortions, and the risk of death due to complications of pregnancy. In Benin, nearly 400 cases of maternal death are recorded annually per 100,000 live births. UNFPA strives in this region of the world to improve access to family planning and to promote individual choice at all levels through partnerships with governments, NGOs, community service organizations, faith-based organizations, and youth groups.